Hi everyone, this is Angelica Lago Silva, Bachelor of Physical Education and Year Level 2. This is me again, and for this video we are going to tackle about the taping and wrapping. Of course, taping and wrapping is all about preventing of any sports injury and whether we had to treat the injured patient using the taping and wrapping. And for today's video, I have my model for us to demonstrate the kind or the type of taping that we are going to say or to talk about it. For the types of taping, we have the ankle taping. For the ankle taping, this is for the foot and this is for our legs. For the ankle taping is we have to tape from here down to our here to here. Oh, never put on the fingers here. So here to here. That's for the ankle taping. For the low dye taping, we have here the flat here. We have to tape round until here and to cover up here to there. That's for the low dye taping. For the TARF 2 taping, we have to round here the tape and put it here. Alright. For the Achilles tendon taping, we have to put a round here, at least any round, and then connect it here, from here connect it to here, and then going to round. We're going to round the tape. That's how we do Achilles tendon taping. And for the shin splint taping, it is very simple, as we are going to tape from our legs to here, legs to legs. That's never put here, just level it here and to here. That's how we are going to tape and wrap shin splint taping. So of course, it should be done correctly. The taping and the wrapping is very important. For the wrist taping, we have to tape our here, and for the palm. That's for the wrist. Raised taping adds support to the wrist, and support products also available commercially. The right taping and wrapping equipment or can be found in any medical store. For the thumbnail, it is we have to tape the thumb for miles, of course, for the prevention and for prevention of any injuries, and for the treatment for mild sprain, proper taping and safe return to play. A simple method to keep the thumb from hyperextending is to tape the thumb to the adjacent finger. So finger taping is only this is we have to tape this. This is just finger support, can be obtained from a simple body taping procedure. This is up to us, the taping for us to prevent any injury that may come to our in a play. Next, we have the elbow taping. It is very simple, as we are going to tape our elbow from here to there. And we have the groin wrap, which is we have to done it with here in the hips and support with in our legs. That's groin wrap and uses for specialized wrap design for this area to help with the rehabilitation and recovery of the patients. And hip flexor wrap, and wrap is identical to groin wrap except that it goes to the opposite direction. Alright, so groin wrap is from left to right, left hips, left legs to right hips, and for the hip flexor wrap is for left hips and to right leg. And of course, the thigh wrap that we are going to wrap our legs or our thigh. So thigh compression wrap can help control the extent of bleeding within the muscle, common when the athlete receive a severe blow to that thigh. So that's all for today. Yes, everyone. So for as far as I experienced from my first year to my second year, our topic is all about physical education, and I thought being a teacher or being a future teacher in the near future in physical education is about teaching. But of course, if you are going to teach your students well, and you need to have your students learn from your teaching, you have or you need to be responsible of knowing and be expert on something that you are teaching for them. And for me, in this taping and wrapping, yes, of course, we have to say we can wrap, we can tape, but there are the standards of taping and wrapping. And all these study, and as an athlete, and taping and wrapping, of course, for me is stylish for everyone. And I'm the kind of person that I'm not fond of taping because it's not going well for me to move, especially in volleyball. And if you are going to tape your hair, your ankle taping is going to be an annoying part of taping, part of stopping the ball from the opponent, because it would be the cotton like, or the cotton fiber of the taping or the bandage is just one tip that the ball is going to stop, and you are not control about it. And being a student here in Foundation University, I'm not thinking about this to know the techniques of assessing, the techniques of maybe we can say first aid, as just as just an athlete, and of course for in the near future, maybe a coach, a instructor of some team that we are going to handle. And it is a very knowledgeable one that we are going to know the kind of techniques, the kind of way how we are going to deal with our athletes, especially when we have the injury of our athletes. And of course, in that time, we are capable of doing something that can be saved, or can have the our athletes not into the severe injury. So thank you for everything, especially to Mom Janine. It has a lot of knowledge that you can impart, a lot of knowledge that you have imported us, and it was being knowledgeable even though this pandemic. And I have a lot of I had a lot of knowledge that I have learned. And of course, it is very accessible for the documents. If sometimes we are going to forget something that is taught from the past years. We have the documents for right now that we can easily access them, and then proceed to the healing or the first aid that we should do in the near future. So taping and wrapping, as a student and as an athlete before, please bear in mind that this is for prevention of sports injury, and of course it is a treatment to avoid severe injury. That's all for today. Goodbye. Thank you.